Hi, I'm Nicole Aaronson. I'm a pediatric otolaryngologist, also known as an ear, nose, and throat surgeon. Last week I talked to you about tongue ties in infants, and today I'd like to talk to you about the procedure to release a tongue tie, which can be called a frenotomy or a frenulectomy, kind of variably. And the procedure itself can be done a myriad of ways. It can be done with a scissors or with a cautery or with a laser. And literature suggests that there are no real advantages to one versus the other. In my practice, I use an age of 4 months as my cutoff of when I will do a procedure in the office or when I would have to do it asleep in the operating room. And that's mostly based on patient safety. When you're smaller, you don't have as much head control and you are kind of less mobile, less able to roll over. And so it's sort of safer for me to control you awake in the office, and as you get bigger and stronger and are moving your head around more, it just becomes less safe to do in the office. Obviously, in much older children, they have teeth, and so that's also an issue. So I just wanted to talk you through today kind of what I would do in my office for these procedures. So if a baby comes in and mom and I review the history and I assess them and there is a tethered lingual frenulum and we make the decision to address that, the way I do it is that I swaddle the infant up so their arms are snug next to their side, and I place them on the exam table with their head facing my chest, and I stand at the head. I always give them some sugar water in the mouth. Data suggests that the best thing we can do for pain control during the procedure is sugar water. We don't typically use topical or injected anesthetics for this procedure. I then use my 2 fingers to kind of hold open the patient's mouth, and I place them on either side of the frenulum, holding the tongue up toward myself. I then incise that band with a scissors and kind of spread that tissue till it kind of forms a diamond shape under the tongue. I usually hold pressure for about a minute or so. There can be generally a very small amount of bleeding that happens. It's usually not a very large amount, but I hold pressure for a minute while mom prepares either to breastfeed or bottle feed, as is her choice. And then I pass the baby over to mom, and the action of sucking on the bottle or the breast actually helps the blood vessels to constrict so bleeding stops, and also soothes the child. The baby's usually pretty upset with me from the moment I put my fingers in its mouth until the moment I hand them over to mom, and they're relatively quickly soothed after that. Some people will use a frenulum retractor to hold up the tongue. Some people will use 2 Q-tips. There's sort of a myriad of ways to do it. Some people stand next to the child rather than at the head. The technique really doesn't matter. It's probably best that each provider does it the way they feel is safest and most comfortable, and the outcomes are very equivalent. After the procedure, I ask the parents to do some stretching exercises under the tongue for the next week or so. That is very variable in the literature. Some providers don't recommend stretching exercises. Others do, for variable frequency and amounts of time. The difference of this procedure in an older child in the operating room is that rather than using a scissors, I use cautery to cut that band. It results in that same diamond shape, but in an older child who's asleep, I will place some absorbable stitches to stitch that diamond shape together. I do that for 2 reasons. One, I feel like if there are no open wound surfaces, there's a lesser chance things can scar back together. And 2, I think if there are fewer open surfaces, it's probably less painful for the child. In the operating room, it's a very short, typically 10-minute procedure. But obviously, parents always prefer not to have a sedated procedure if they don't have to. So if you are concerned about feeding difficulties in an infant, ideally it can be assessed and addressed before 4 months of age. Recovery from the procedure is very minimal. It's generally very well tolerated, and most people are back to their usual business by the next day. So highlights of this is frenotomy is a procedure that can be performed usually in office before 4 months of age, and after that in the operating room. It's a brief procedure with a relatively easy recovery Things we worry about are bleeding and not affecting any of the surrounding structures, but those are both very uncommon complications of the procedure. Once again, thank you so much for watching. If you have any suggestions for topics, feel free to drop them in the comments, and please subscribe to Dr. Nicole Knows.